Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Josh Diamond has worked with young people for over 10 years. He believes in the power and possibility of relationships and in loving kids for how and who they are now. Josh has taught sexuality education, facilitated youth development and leadership programs, and worked with teachers to strengthen their inclusivity practices. In his current role as the Director of Partnerships with the Appalachian Replication Project, he works with educators and community agencies throughout Southwest Virginia to implement evidence-based youth development and sexuality education programs. He lives in Harrisonburg with his partner Lisa and their 2 children. Katie Mitchell, who serves as Director of Training and Fidelity with the Appalachian Replication Project, is a longtime educator who currently trains teachers in middle school sexual health programming. She has worked in public health education at JMU since 2016. She lives in Timberville, Virginia with her 2 teenage kids. When not working, Katie enjoys hiking, going for a float, reading in a hammock, chatting around the fire pit, and generally doing anything outdoors. Finally, Katie Forsyth serves as the program coordinator for the Appalachian Replication Project grant at JMU's Institute for Innovation in Health and Human Services. She is a certified health education specialist and holds a bachelor's in business information technology from Virginia Tech, as well as a master of education in health education from Penn State. Before this role, Katie worked under another grant facilitating sexual health programming in middle schools in the Shenandoah Valley. She lives in Rockingham, Virginia, with her husband and cat, and enjoys exercise, traveling, anything related to food and wine, and the outdoors. So, Katie M, Katie F, Josh, welcome to the Dissect and Connect podcast.
Thanks for having us.
So, let's get right into it. Katie F, we'll start with you. Can you give our listeners an overview and some background on the Appalachian Replication Project?
Sure. So we work for the Institute for Innovation in Health and Human Services, or IIHHS, at JMU, and that's under the SexEdVA program. The Appalachian Replication Project, or ARP, is the grant our team works under. So this is a 3-year grant. It was awarded almost a year ago by the Office of Population Affairs, and its main goals are to replicate evidence-based teen pregnancy prevention programming, as well as to use a systems thinking approach that looks for leverage points within a community or population, and just basically to improve the overall youth health within that population. So our parent program, SexEdVA, has been delivering TPP programming locally for the past decade or so, and we have seen significant decreases in the teen pregnancy rates here. So based on that, we applied for the ARP grant, and we are hoping to share that kind of collective experience and success to other areas across the state. So we chose Southwest Virginia as an area that's kind of similar to our own, very kind of rural, conservative, a lot of similar ideas, so that we can kind of replicate what we've done here. So our focus currently is on middle schoolers, grades 6 through 8, and we are offering training, technical assistance, and funding to schools and community agencies to facilitate different programming. So the 2 that we're offering are Draw the Line, Respect the Line by ETR, and that's kind of a more traditional school-based program. And then the second one is Wyman's Teen Outreach Program. And that is a smaller club format that kind of focuses on positive youth development and community service learning.
So, what led to the focus on teen pregnancy prevention specifically?
Throughout the past couple of decades, our parent organization of SexEdVA has kind of gone through different iterations, but teen pregnancy prevention has always been a part of IIHHS, the institute we're under. And that was started before any of us were a part of the program. And we've been fortunate enough to get continued funding so that we can grow as a program, kind of serve this community need. And now we're kind of looking across the state. So just furthering what we've been able to do here. Part of our mission is that we believe that youth have the right to sexual health information that is positive, inclusive, evidence-based, and medically accurate so that they can make informed decisions regarding their health and their futures. So that's really what we're working towards.
Josh, I'll turn to you now. What factors contribute to a community that has a high rate of teen pregnancy?
Well, unfortunately, we can't say that there is one specific cause for higher rates of teen pregnancy prevention. It really amounts to a complex sort of matrix of different issues and social problems that may have a community end up in that situation. But one of the things that does cut across communities that have higher teen pregnancy prevention rates is socioeconomic status, and poverty. And so we can generally see that areas with high levels of poverty and lack of opportunity have higher teen pregnancy prevention rates. Opportunity in particular, because when young people don't feel like they have a lot to look forward to or genuine, real opportunities to succeed and achieve and be admired in their communities and beyond, there's not a lot of reasons to practice safer sex practices. Now, along with poverty, of course, you might have less health care, right? So you might have less access to health care, less access to contraceptives, and less active access to quality educators and quality education, right? So one of the reasons why we're taking a systems approach is that we think that while education is very important and making sure that all young people have the information that they need to make safe decisions, issues of poverty and access to healthcare are really important, which require us to have a bigger look beyond just education or just condom demonstrations, for example, or contraception education. And, depending on who you talk to, some people might say that unhealthy notions of gender also contribute to pregnancy rates, or areas that have high rates of maybe assault and also non-consensual sexual relationships can also contribute to higher teen pregnancy relationships where people don't often have common power dynamics. So again, teen pregnancy is hard because you can't just say, well, that's it, right? We can point to it. It really is a big combination of factors, which is why our current grant is looking at trying to get together coalitions as well as schools to look at what is the whole system in place here and where are the leverage points where we can make the biggest impact in teen pregnancy, whether that is access to youth sexual health services or whether it is education or whether it is maybe teaching healthy versions of masculinity, whether it's job opportunities, whether it's youth community service. So we're really trying to encourage people to think really broadly about this as we do the work.
This may be our first episode where we've had two guests on the same show with the same first name. So, Katie M., the next question goes to you. What kind of information is covered in the Draw the Line, Respect the Line curriculum?
Okay, Draw the Line, Respect the Line is a 3-year middle school evidence-based and abstinence-based program that addresses personal boundaries, peer pressure, sexual or relationship pressure, STDs, STD and HIV prevention, pregnancy prevention, healthy relationships, consent, all manner of those types of things. And the 6th grade program does not have any sexual content. It's mainly about peer pressure and learning refusal skills and learning about healthy relationships and things like that. And then the sexual health content comes later in 7th and 8th grade.
We'll stay with you, Katie M., on this next question. Why is it important to provide this education to students at the middle school level?
That's a good question, and that's one that we hear a lot from community members and parents and even students in our classrooms ask, why are we doing this? And there are a number of reasons. One, we are trying to provide students with tools to make informed decisions about their sexual activity and sexual health before they become sexually active. So we're hoping that if we can get in there when they're a bit younger, that we'll achieve that. 2, some students already are sexually active and they need to know if they're engaging in risky behaviors so that they know better how to protect themselves. A 3rd reason, middle school is typically when, puberty is in full swing and students have a lot of questions about what's going on with their bodies. So that's a great time to talk about all of this. And so all those reasons make it a developmentally appropriate time for those conversations.
But Josh, this is really more than just about sex, right?
Absolutely. There's actually one of the programs that we're working with, the Teen Outreach Program, which is a positive youth development program that tries to access and develop young people's strengths and potential through community service and life skills. One of the lessons we have there, it starts off with the word sexuality, and we put it up on a big piece of paper and we say, what word sticks out to you when you look at this word sexuality? And most kids will say sex, right? And then we'll circle the word sex. And we'll say, well, sex is really just one part of this thing that we call sexuality, right? And a lot of times people go straight to intercourse, right, between men and women. But sexuality or sexuality education is really broad, right? Our sexuality has to do with our sense of our body, our sense of self, who we're attracted to, how we're attracted to those people, our sense of gender and gender expression, our desires, our pleasures, our things we don't like, right? Just our physical nature is wrapped up in all this kind of stuff, right? How we express and talk about intimacy. It's not birth, right? Childbearing, pregnancy, raising children. It all involves sexuality in some way, shape, or form. And so when we talk about, sexual education or sexuality education, we're really talking about how we relate to one another and how we do that with respect, with consent, with dignity, how we prioritize our own health and the health of other people to keep young people safe. And so, sexuality is one of those really fascinating subjects because it really is kind of very tied into just what it means to be a human being. And so it can be quite deep. I'm not saying we go there with young people or that we necessarily encourage educators to do that, but it is beyond just intercourse. Intercourse is obviously important, and we have to talk about the risks and the consequences of intercourse. But there's also a lot more, that I just mentioned. So yeah, it's a pretty deep subject regarding human nature and just what it means to be a person.
Katie M., let's go back to you for this next question. So how does this fit in with the stuff that kids are already learning in school? Some parents or community members might ask, aren't they already getting enough of this through PE or family life? How does this help or make a difference in addition to that?
Well, the state does provide and publish SOLs about family life. So there are published standards, but the state doesn't necessarily provide any standard curriculum for schools to use. So sometimes we find that schools are just struggling to kind of put together or scrape together just some kind of programming that will work with the time constraints that they have and the number of students that they have and how to deliver it to all of the students and all of those different kind of constraints. And sometimes programming is not necessarily comprehensive or it's dated. It may not be medically accurate anymore because it's just been sort of drifting through the department for a long time. And so students might not be getting, as you said, enough of this through PE or family life. And because it's a 3-year program, it builds on prior knowledge each year. So we feel that by the end of 8th grade, students have a pretty good understanding of how to prevent unplanned pregnancies and STDs.
Great. And Katie M., we'll stick with you for this next one. So what would you say to parents or guardians who might be skeptical or unsure about whether or not they want their child to participate in this kind of instruction?
One, I would remind people that the reproductive system is just as important as other bodily systems. Students learn about their respiratory system and the nervous system and the digestive system and how to keep those things healthy. The reproductive system is no different. It can also become diseased and infected, and those can have long-term consequences. And all people deserve to know how to protect their bodies. Also, students who understand personal boundaries or sexual boundaries and who know anatomical terms, who understand how the reproductive system works, who understand consent and healthy relationships and all these types of things that we talk about and draw the line, are less likely to be victimized at some point in their lives. And there's this common misperception that we hear frequently that talking to teens about sex encourages them to become sexually active. And research shows totally the opposite, which is that the more teens know about the risks associated with sex, the more likely they are to wait, and the more likely for them to feel empowered to make their own choices.
Kind of along the same lines of what we've practiced in the mental health field for years. When someone has suicidal ideation, to come out and ask them if they have an active plan, that doesn't necessarily mean that that's going to encourage the person to take their own life. So that's the one parallel that I guess comes to mind for some people.
Yeah, and I mean, teenagers have no way of knowing what they don't know. It's up to us to say, hey, this is something that you're probably going to want to do at some point, but there are consequences. There are risks associated with it. And here's how to avoid those risks. And I think everybody deserves to know how to protect themselves.
And obviously, too, with the prevalence of social media in the lives of young people now, there's a lot of content, information, not necessarily good information, but stuff that's out there that they're already seeing and have access to, right? So we might as well give them the proper information, the right information, so they can make better informed decisions, right?
That's true. I mean, when I was a middle school student, most of the information I got about sex was on the bus ride home from school, because we didn't have smartphones and internet and all that stuff like right at our fingertips. And these days, teenagers can stumble onto porn or be shown pornography by a classmate or an older sibling or something like that. And that's not necessarily developmentally appropriate. And so we are trying to get ahead of that and teach students how to talk about their bodies and how to respect people they might be in a romantic relationship with at some point, and how to avoid diseases and unplanned pregnancies.
Was just going to add too about, when we talk about, bodies or sex or sexuality from a shame-based perspective, or that when we don't talk about it at all, then that the implicit message is that there's something wrong with talking about it. And so then a lot of people start to get curious, because that's just what happens with humans as we grow up. We get curious about our bodies and other people's bodies. And instead, things happen secretly, right? They happen without direction or guidance, or if somebody is thinking about something. I mean, our goal is that parents are the primary sexuality educators of their students, of their children. And that ideally, if a child has feelings happening for them, that they have a safe person that they can go to and say, so I'm kind of feeling these things and I don't quite know what to do with them, or I like this person and I may be thinking about this, but I don't know if that's right or wrong. And a parent can navigate that conversation and say, well, I don't think you're ready, or I want that for you, or let's talk about all the information that you need so you can make the safest decision. Or is this the person that you want to do this with? Because, I've seen some things that concern me, right? And so parents still are the biggest factors when they're young, their children do engage in sexual activity. And I know for me, as a public health educator doing sexuality education, how many times when I've been walking through the lunchroom and somebody comes up to me and asks me a question, because I was their sex ed teacher, that I know if I wasn't here right now, who would they have gone to in a situation that I don't think would have changed, right? They would have came to me and say, so there was an accident, so to speak, and I need resources, right? And we could say, well, here's where you go. Those things happen all the time, and it's a matter of can young people bring those things to the adults in their lives, or do they just suffer in secret and then end up with a situation that either gets out of control or that leads them down a path that's going to be a lot more challenging otherwise.
So KDF, I'll turn it over to you now and ask, from the perspective of the school system or a community, what are the benefits to having lower rates of teen pregnancy and sexually transmitted infections?
Well, we know that teen pregnancy and childbearing can bring substantial social and economic costs, both immediately for a person and later on in their life, both for the teen parents and for their children. Now, that's not in every situation, but statistically, that is greater of a risk, right, for these people. So a teen birth can disrupt educational career goals, affecting earning potential later on in life, also then affecting their future family finances. So that just sets up the situation from the beginning. Research also shows that only about half of teen mothers actually earn a high school diploma, compared to about 90% of women who don't have a teen birth. So that's significant. They're also more likely, teen mothers that is, are also more likely to live in poverty and then depend on public assistance. So as health educators, we don't really like to think this way, but all of this kind of creates significant costs to taxpayers and communities providing this extra support for these folks. So, just educating people like the ways that we're speaking about kind of leads to these healthier decisions and leads to these lower teen pregnancy rates, which ultimately, down the line can contribute to healthier, happier populations that are more educated and just more contributors to society and their schools or their communities, whatever level. And then just people can choose the way that they want to live. So,
Katie F., you mentioned at the beginning of our conversation the success that you all have had with implementing this program in the communities surrounding JMU. Can you talk a little bit more about that and give a little bit more specifics around the rate of success that you've had with this program?
Sure. So my other teammates may chime in if I get something wrong here, but I think we've been doing this since around about 2012, and we have worked in Harrisonburg City, Page County, Rockingham County, and I think we've implemented programming kind of at different times, either different ages or different grades, just kind of depending on where that school system was at and what they were able to do. But overall, we have seen a 68% decrease in teen pregnancies through that time period. So, causation, correlation, but we do take some of the credit for that rate. So it's pretty exciting for around here.
That is a significant number.
Absolutely.
Yeah, that's impressive.
I was reading this morning, and I read that the United States actually has one of the highest teen pregnancy rates of any other developed country. Canada, most European countries, we have a higher rate. Now, the teen pregnancy rates since the early 1990s have been steadily dropping nationally, but they are still higher in the United States. They are particularly higher in rural southeastern counties throughout, both Virginia and throughout the Southeast.
Interesting. Josh, let's talk about the impact of the COVID-19 pandemic on the sexual health of young people. Is there anything that we can see already from the past year that maybe is an indicator about how that's been impacted?
I think it's a little too early to say specifically what's happened. I'll be interested to see, mainly because, stats around teen pregnancy don't really show up, and young people are just now kind of starting to come out from the darkness of the pandemic and into the public light again in schools. And I think all these, the isolation and the impacts of that are going to start to show up. But, one of the things that do happen is sometimes you see spikes in teen pregnancy, like right after school ends or when school is out. And so, young folks who just don't have a lot of other meaningful outlets, find ways to be in relationship. We also had a lot of young people home during the day when their parents weren't around, right? And so you had opportunities for young people to get together, which means more opportunities for sex. Now, I don't know, like locally, for example, our crime rates went down. So I can't really say. It's possible that the sex rates went down, even if typically, we might see that under certain similar situations that it might go up. But, I think the mental health concerns, I think anytime you have all these compounding risks, just health in general, it might is going to worsen, and so, it's yet to be seen exactly what are going to be the consequences. But we do know that if it's in Virginia public schools, if it's not tested and schools aren't accountable for it, they're not going to necessarily prioritize that education. So I think a lot of young people across Virginia did not get sex ed this year. And that's in a state where some places don't really have meaningful sexual education programming. So, that's part of the reason why we developed the asynchronous online version of Draw the Line, Respect the Line. And we're offering that to schools and community agencies to try to fill in some of those gaps. But I think sex ed can be one of the first things that goes, because it's not in that category of a core academic discipline. So, it's the math, sciences, English, the stuff that we know that if our kids don't pass the SOLs, we're going to lose accreditation or lose money, are the things that got prioritized during the pandemic. And so some of those other things that people didn't see as priority probably did, were lost during the past year. And I'm sure that also had some effects as well.
A good sound knowledge of sexual health won't necessarily get you into the honor society.
No, but it could keep you out of it.
It should.
It should. I totally agree. I totally agree. So, Katie M., are there some resources that you could share with our listeners related to this topic?
Yes, a couple of places I go, websites that I go to learn things or to use information. One of them is called talkwithyourkids.org, and they're out of California. And the website contains lots of tips for parents and teens, especially around how to have conversations with your teenagers about sex and relationships and things like that. They also have a really hefty book list, recommended reading list on the website. And they have a Facebook page that is fairly active and full of great information as well. And then another one I use from time to time is called adolescenthealth.org. And it's a lot of the same types of materials. It's all sexual health topics. The Talk with Your Kids one, I feel, is a little more user-friendly. And the adolescenthealth.org one seems to have more of a medical lens or feel to it. But both of those have some great information.
Okay, great. I will be sure to include links to both of those in our show notes for today's episode. Any resources from you, KDF, or Josh, that you want to add?
Sure. I'll add, kind of like we were talking about before, we just always encourage youth in particular to make sure that they're looking at reputable resources. So when we're talking in class, like, hey, a question comes up, check out a website like the CDC or HHS, those government agencies that are backed by science and, are vetted by health educators and public health officials. So just make sure you're looking at those types of places instead of someone's blog, for example.
Lots of bad information out there that you want to stay away from. Yeah. Great. Thank you.
I'd also add local health departments. For some of our partners are local health departments, and two, for young people who don't have access to health care or interested in birth control or contraceptions or free condoms. Most of them can't access them through their local health departments. And teens, as long as they're of the age of consent, can receive sexual health care without the knowledge of their parents. If there's fear there that their parents find out about sexual activity, that they could get kicked out, right? Then kicked out of their home or punished or any of those kinds of things, they can't access their local health departments. I know that some of the challenges of Southwest Virginia in particular is the distance and some of the geographical isolation between health departments and transportation. Not having centralized transportation can make it difficult for young people to get to a place. But any and all Virginia Department of Health should have free condoms for anyone, and also drastically reduced or free sexual health care for young people who are at least age of consent.
We are fortunate in the New River Valley to have a very strong local health department that serves our region, so I'll be sure to include their information in the show notes as well. So, parting words of wisdom for our listeners. Anybody want to take that on?
I can start. I think for me, just the biggest thing that we're trying to do is just demystify sex ed and just educate youth and their families about that it's just not as scary as you think that it is, right? There's a lot of beliefs and a lot of fear and just, again, misinformation out there. So just trying to bring all that into light and just show that it's education and that our goal is to provide that evidence-based, medically accurate education so that people can make their own decisions, right? And make the healthiest decision that they can. So we're not trying to push an agenda or our belief system, just trying to provide that education for them and their families. So,
and that when you do scary things, it opens up space for other ways of being and doing and thinking and feeling. And so, the promise and the potential is in when the young people start showing up more, when your teen pregnancy rates start falling. But it can be scary. Anything new, right, where you might get pushback, can be scary, right? But typically doing the scary things are also the most rewarding and can have the biggest impact.
That's pretty good advice in general.
Yeah, I'll add that, there are consequences for everything, good and bad. And everyone deserves to be happy and fulfilled. And a big part of that is a person's health and physical well-being, emotional well-being. Those things cannot be ignored just because they're tied to the reproductive system, which is a little controversial, right? So I really believe in empowering people with the knowledge they need to make informed choices about their own lives and their own bodies.
Well, if that's not a perfect closer, I don't know what is. Really have enjoyed the conversation, and I'm excited to partner with you all to help get this out in the New River Valley lots of good information, and obviously something that we as community members, parents, grandparents, guardians should all be mindful of in helping our young people develop and grow and be healthy and responsible. So thank you all so much for your time today, and let's have you back on the show again at some point in the future.
Thanks for having me.
Thanks, Mike.
We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners or New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.